Good afternoon everyone, myself Dr. Prashant Makhija and I'll be answering your queries related to stroke and headache at Sify.com.
Facts related to stroke occurrence.
Stroke or brain attack, as they say, is the result of impairment in blood supply to the part of brain. Depending on the cause of impairment of blood supply, stroke is basically of two types. The first one is the ischemic stroke, which is the result of clot in the blood vessel, which is leading to the interruption of blood supply to the brain. The second one is the hemorrhagic stroke, which is the result of leakage of the blood from the blood vessel, that is due to rupture of the blood vessels. Overall, 85% of the strokes are of the ischemic variety. Speaking about the epidemiology, worldwide approximately 15 million cases of new stroke cases occur every year. Of these, about 1/3 die and about 1/3 are permanently disabled. As per WHO estimates, a stroke occurs every 5 to 6 seconds. Worldwide, stroke is the 6th most common cause of disability, accounting for about 10% of the deaths worldwide. Speaking about India, approximately 1.5 million cases of new stroke cases occur every year and around 0.5 million of the stroke related deaths occur every year.
An update on the available treatments of stroke today.
Last 3 decades have witnessed significant advances in the treatment of stroke, particularly in the management of ischemic stroke. After the 1995 NINDS trial, the clot busting medication TPA or L-tiplase has been approved for use in ischemic stroke. There are now also devices which can mechanically remove the clot from the blood vessel. But the idea is to rapidly administer these medication, as there is a narrow therapeutic window within which these can be administered. The idea is to rapidly restore the blood supply so that deficits related to stroke can be minimized or reversed.
Realizing one's headache triggers.
There are several trigger factors which can precipitate a headache or a migrainous attack. Some of the common ones are stress. Any amount of stress can not only cause a tension type headache, but it can also be a precipitant for migrainous attack. Then strong smells or perfume odor can also precipitate a migrainous attack. Women during menses, because of the hormonal changes, are likely to have more frequent attacks during the menses time. Also, vigorous exercises and even excess sexual activity can also precipitate an acute migraine attack. There are certain food items which are known to precipitate migraine attacks. Some of the common food items are cheese, which contains tyramine. Red wine in particular is also known to precipitate a migraine attack, and some have increased propensity to migraine attacks by taking nuts. Also, skipping your meals can also be a precipitant for migraine attack.
Myths and facts related to migraine.
There are several myths and misconceptions related to the migraine attack. Some of the common ones are, the first one is migraine is a psychiatric or psychological disorder. The fact is, migraine is a neurological disorder. Though stress can be a precipitant for migraine, but migraine is definitely a neurological disorder. It is caused by alteration in the dynamics of cerebral blood flow. In addition, there is some release of neurotransmitter which can act as sensitizer to the pain sensitive structures in the brain. The combination of these two triggers a migraine attack. Another myth is migraine attacks occur only in adults. The fact is, migraine usually starts in the adolescent age group, and around 90% of the patients have had their first attack before the age of 40 years. Migraine can also occur in children, though there may be some variation in the symptomatology. Another misconception is migraine occurs only in women. The fact is, although more common in women population, migraine attacks also occur in men. Around 18% of the women population is affected by migraine, and around 6% of the male population is also affected by migraine. Another common misconception is migraine presents only with headache. The fact is, though headache is a prominent feature of migraine, there are also associated some features like nausea, vomiting, intolerance to the light as well as sound. And sometimes migraine patients have some aura symptoms which precede the headache attack. These can be in the form of visual disturbances, some sensory or motor disturbances. And in some cases, patients can have aura without migraine headache, and this entity is known as acephalic migraine.
Key to neurological health.
Key to neurological health is adopting a healthy lifestyle. One should eat healthy, one should have adequate intake of fresh fruits, vegetables, and also fish, which are rich source of omega-3 fatty acids, which are known to promote and help in repair of nerve. Also, strict vegetarians are at increased risk of B12 deficiency, so they can take supplements for the same. Staying active is another lifestyle measure which can be incorporated in the lifestyle to promote neurological health. One should at least exercise daily for about 30 minutes a day in the form of brisk walking and up to 5 days a week. This not only promotes one's physical health but also reduces your chances of having a stroke. Having an adequate sleep for at least 7 to 8 hours not only promotes memory consolidation but is also necessary for restoration of the brain activity. Avoiding stress by practicing meditation and yoga is an important factor for promoting neurological health.